Good morning, everyone. As a preliminary matter, this is Stephen Vigent, Chairman for the Board of Health. Please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dr. George Abraham.
Present and can hear you.
Thank you. Jenny Fishman.
Present, and I can hear you.
Staff, when I call your name, please respond in the affirmative. Terry Stockwell.
Affirmative, and I can hear everyone.
Very good. Anticipated speakers on the agenda, please respond in the affirmative. Phil Legere.
Affirmative, I can hear everybody.
Okay. Micah Blondo. Not here yet?
He's not here yet.
Okay. Jennifer Nakajoba.
Present, and I can hear you.
Thank you. DJ Wilson.
I'm here and I can hear fine.
Very good. Good morning. This open meeting of the Shrewsbury Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation, however, as required by law. This meeting will not feature public comment. For this meeting, the Shrewsbury Board of Health is convening by remote participation with a call-in number of 617-675-4444 and a PIN number of 130-333-107 4063 #, as posted on the town's website, identifying how the public may join. We are now turning to the first item on the agenda, but before we do so, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I, Stephen Vigent, the chair, will introduce each board member or staff member who has the lead role for this particular item or guest speaker associated with this item on the agenda. After they conclude their remarks, the chair will go down the line of members first, and then to staff members, inviting each by name to provide any comment or questions. I will then call upon the members to offer a motion and then for a second. Please hold until your name is called. Further, please remember to mute your phone or computer when you are not speaking. Remember that unless a document is being shared, your camera feed is triggered by your speaking or background noise. To mute and unmute your telephone dial star 6. Remember to speak clearly and in a way that helps generate accurate minutes. If members wish to engage in colloquy with other members, please do so through the chair, taking care to identify yourself. Finally, each vote taken in this meeting will be conducted by a roll call vote. Okay, pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 38, Section 20, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Shrewsbury Board of Health will be conducted via remote participation to the greatest extent possible. All meetings and hearings listed in the agenda will also be done through remote participation. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the town's website at www.shrewsburyma.gov/coronavirus. For this meeting, members of the public who wish to listen or watch the meeting may do so by visiting www.shrewsburymediaconnection.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the town's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. To participate in the public comment portion of the meeting, dial 617-675-4444 and enter the following PIN, 130-333-107-4063 #. Please mute your device until the chair of the Board of Health addresses your agenda item or opens the meeting to public comment. I would like to call the meeting to order now. And the first item on the agenda is the review and approval of minutes from the August 21st, 2020 Board of Health meeting. Has the board had a chance to review the meeting minutes? Dr.
Yes.
Abraham?
Yes,
Jenny
Mr.
Fisher?
Chair, make a motion to
Yes.
approve it also.
Okay, we have a motion to approve the minutes. Do we have a second?
Yes, you do. I second.
Okay. The motion has been made and seconded. All in favor of approving the meeting minutes signify by saying aye. George Abraham?
Aye.
Jenny Fishman?
Aye.
Stephen Vigent? Aye. So the meeting minutes are approved. The next item is to review and act on updating the local tobacco regulations. This item is in regard to revising the current Shrewsbury tobacco regulations and updating them to the current state regulation. In that regard, the board members should have received a draft copy provided by DJ Wilson. DJ Wilson, you are available, right?
Yes, I am.
Okay. I have gone through all of the changes in yellow that correspond to the updates for the state regulations, and I don't see any issue with those since the whole point is to be consistent with the state regulations. Are there any further comments or questions from the board in regard to the updates?
No, none regarding the changes in yellow, Mr. Chair. Are the changes in green something that we need to vote on?
Yeah.
Yes, it is. So as I see it, there are two items I believe that need to be addressed by the board. Let me start with the one having to deal with the banning adult smoking bars. I believe that 2 meetings ago, the board had decided not to address a ban of smoking bars in Shrewsbury, if I remember correctly. Is the board still okay with that?
Yes, Mr. Chair, and can we? Is that for any other reason other than to wait for more cogent guidance from the state or the governor?
I think it was primarily to simplify things in order to revise the regulations to be consistent with the state regulations, and that the prohibition is really kind of a separate item for the Shrewsbury board to consider.
Got it. Okay. So we can. So I'd be supportive of deferring decision on smoking bars for now.
Yes, that's what we had talked about 2 meetings ago. I believe we said that we would wait on that for a future time.
Yes. So I'd be supportive of continuing to wait on that.
Right. Did we talk about having to do a public hearing on that?
Yes, we did. We did discuss about having a public hearing. You mean on the changes to the regulation? Yes. And there's also a second item that I wanted to address, and that is in the definitions section of the regulation about adult-only retail tobacco stores, there's a reference to a a distance restriction in terms of 25 to 500 feet of retail within a tobacco sales permit. I guess in that case, since we're not addressing adult-only retail tobacco stores, should we consider that now, DJ?
Let me explain why that additional sentence is put in. We've had
Okay.
instances around the state where a regular general tobacco retailer has thought to divide their store in half, either with a wall or just a simple room divider, and call one half an adult-only retail tobacco store and the other half remains the same convenience store it was. And so that is not the intent of the state law to do this. They are supposed to be two completely separate businesses, as though they would be on opposite sides of town. So this sentence just makes sure that doesn't happen.
Okay, so in that case, I think we should have this sentence in the definition section. It's just a matter of deciding what distance to include in here. DJ, if you have experience with other boards of health or have a recommendation in regard to a distance?
In reality, to quash the example I just gave, the lowest amount, 25 feet, makes the most sense, because then you wouldn't have a store opening within a store. So I think that does make the most sense, just to stop what I was talking about.
Okay, so in your opinion, the 25 feet is sufficient, and we don't need to go much higher, like the 500 feet, which is the range given here.
Correct.
Okay, I'm okay with that. Given DJ's explanation, I'm okay with the 25 feet to be included in the regulation. George Abraham?
Yeah, me too.
Jenny Fishman?
Yes, I am.
Okay. So I think in that case, we understand where we're going with the regulation, so we'll need to get a final draft of the regulation to read as will be approved at a public hearing. So I don't know if DJ, do you get involved in that, or?
Yes. What I will do is I'll refine the draft further. I'll provide you a still color highlighted just to show those changes, and one that doesn't have any highlighting, so you have a signable draft actually. And then when you set a hearing, I'd be happy to attend. Just let me know the date.
Okay, that would be great. Thank you very much. Okay, so in that case, we had talked about before about scheduling a public hearing in regard to the regulation. Maybe we should address that when we get to the meeting schedule, but before we get there, I just wanted to get the board's thought on scheduling a public hearing just before our next regular meeting, which we have done before in that regard. And I would anticipate this would be a fairly short meeting, because we're basically just incorporating state regulations that have to be met anyway.
Yes, if you're going to not decide on smoking bars, I think you would actually have nobody show up.
Okay. So if the board is okay with this, when we get to the meeting schedule, I would propose that we schedule a public hearing just before the next regular meeting. Dr. Abraham, are you okay with that?
Yes.
Jenny Fishman?
Yes.
Okay. Very good. So let's move on to the next agenda item, review and act on the report from the Central Massachusetts Regional Public Health Alliance.
Just as a note, I'm gonna leave the call, DJ Wilson.
Okay. Thank you very much, DJ, for coming on and for all your help in this regard.
Sure, and Kerry will let me know of the date.
Sure.
Thank you.
Morning, Phil here. So I'm just going to go over some highlights on the Alliance report. Stop the spread test sites, that has been extended actually to the end of October. Worcester's in the red category for positivity rates. I mean, they're kind of on the edge of it. But anyways, that extends that program. You can go to mass.gov info details, stop the spread at Worcester. So that's in place. CDC Foundation, staff support, nursing folks have 2 staff. We've been unsuccessful in getting one for us. I think part of the reason it's a part-time, 20-hour week, 6-month position, and folks either find other opportunities. So we're reallocating that funding to some of the other teams. So working on that. Flu clinics are starting to come up. I know there's an employee one that Terry sent out information. That special enforcement team to assist red communities are available to Worcester. Comprises of Department of Labor Standards, Alcohol Beverage Commission, and Executive Office, the cabinet level team. So I know that Karen's been out several times on enforcement. Again, it's not like we have any extra people doing any of this, so 7 months in and no end in sight. So one day at a time. Again, I want to thank Terry for all her work, keeping following up on complaints that come in and keeping up with the materials to send out. On the Triple E front, knock on wood, we're doing okay, and even though we might be complaining about cold temperatures, that's also going to keep the mosquito activity down. So there's a silver lining there. Nursing team continues to be busy. Emergency preparedness team continues to be busy, like everybody. The emergency preparedness team starting to get some information from the CDC about COVID allocations. Again, the first COVID vaccines are going to go to priority folks, healthcare, first responders, things like that. We're not going to get any volume of vaccine, even though our current president seems to think we are well into 2021, but we still should be going out there and getting our flu vaccine. I know I'm getting the high test senior one as soon as I can. Any questions on the Alliance report?
Dr. Abraham, do you have any questions? Hello?
Did we lose them?
My apologies. I didn't realize I was muted. I apologize. So none specific.
Okay.
Phil, are we pushing the flu vaccine already?
Well, we're pushing the information. Again,
Okay.
our allocation in general, we get it for the uninsured. And actually, I'm not sure of the status of whether we've gotten a delivery yet.
Okay. No, our timing wise, we generally recommend October 1st and after so as to be able to cover the entire flu season. That's consistent with CDC and other guidelines. So I was just curious. I know pharmacies generally try to push it out early so as to be able to have their stock consumed. but in the best interest of patient and public health, I think October 1st to March 31st is usually the window that would be recommended for flu vaccine administration.
Correct, yes. So I don't know of many clinics that are starting up. I mean, there's some that are starting up like next week. I mean, late September. And I know we have one in my little town, October 14th. We're doing a drive-through.
Yeah.
That's our senior meal day. So folks are mobilizing and preparing. So
Great. No further questions. Thank you for your good work as always.
thank you.
Yes, thank you, sir. Jenny Fishman, do you have any questions?
I do not.
Okay, and I just want to echo Phil's comment on Kerry keeping up with all of the ongoing work relative to COVID-19 and dealing with all of the constant updates to the guidance and keeping up with complaints and so forth. So thank you, Kerry, for all of your work there.
Absolutely. Thank you, Gary.
My pleasure. One day at a time. Thank you for your support.
So I was going to move on to the inspection report. Micah,
Yes.
I don't know where he is. Again, we've been busy in general. As you can see, trying to keep up with routine and complaints and any new food establishments that are coming in. Actually, we have one that's changed, wants to have a food service permit. They had a wholesale permit still due, but changing their business model, adapting to the new normal as far as food service, wants to be able to do some takeout. So we're working with that. And in general, again, we continue to get COVID complaints almost every day. I don't think there's been a day where we haven't had one of some sort. Again, Kerry does an excellent job reaching out to them and going forward with that. So looking at that, the total number of 52 inspections. There are many communities that aren't out there doing routine inspections. So, I want to thank my team for being out there, Micah, Julie, and Danielle. And then we're keeping up with septic work as it comes in. So that's been ongoing. There's most likely with the cold weather starting, there's usually a little uptick on that. Jobs trying to get done before cold weather. So I'm seeing that across the Alliance, a little uptick. So that'll continue till ground freezes. And then we'll have our little break with that, usually January, February into March. So kind of looking forward to that in some levels. But anyway, we're keeping up with that. And again, Terry does an excellent job keeping those folks up to date and letting us know when inspections are needed, etc.
Okay, Phil, this is Steve Vincent. Do you have a sense of how the farmers market is going this year?
Me, truthfully, no, I'm there. But Carrie might have a little update on that because, again, I haven't been to one this year. Usually, if I'm in town, I haven't been to any. Carrie, you have any sense of that?
Yep. So it's gone well. I think that the organizers did a great job in doing their homework on what the COVID protocol would look like. Lots of signage, lots of visuals. Usually on Wednesday mornings, I send out a reminder to the residents, only a couple weeks left, come down, support your local vendors. And we do have a new vendor that'll be starting this coming Wednesday called Cabin Goddess. If you're interested in jams and jellies, she will be new to the market for the last 2 weeks, and then it ends on September 30th. And I commend all of the vendors for participating during this difficult time. I think they've done a great job.
Okay, thank you, Carrie. And do you know how the food truck events are going? Is that a pretty popular thing?
Yeah, it was a little clunky at first because we weren't in the initial conversations, but as we've gone along, I network very closely with the organizers, and basically it's 2 consistent mobile food vendors each week with the addition of a different venue. So yesterday, Micah inspected Anzio's Brick Oven Pizza, and we have Traveling Bones that will be anticipated for next Thursday's venue. And I don't get the feedback directly, but based on the inspections, the food vendors have done a great job, and Micah has been instrumental in doing those inspections.
Okay, great, Carrie. Are there any other questions, comments from the board?
Traveling bones, are they human or dog bones?
They're just bones.
Sorry, Mr. Chair, I just had a bone to pick. That's why.
Hopefully they're ribs or something like that.
Touche, touche.
Okay, if there are no other comments or questions, we'll move on to reviewing the meeting schedule, which will include a public hearing on the revised tobacco regulations just before the meeting. How is October 16 or 23rd look okay to the board?
October 16th works great, Mr. Chair.
Okay. Jenny?
Just checking my schedule. Hold on.
Sure, go ahead.
Yes, that looks fine.
Okay, so let's schedule the next meeting and public hearing for October 16th. Before we go, I just wanted to turn the board's attention to one of our reference materials. It was an email from Sanam Zaire, 8 Jamie Lane, Shrewsbury, regarding racism as a public health crisis in Shrewsbury. I just wanted to get a sense of the board if you would like to put this on the next or a near-term meeting agenda.
I would be completely supportive. Nationally, there's a huge degree of conversation. Several medical organizations have already come out with statements about being anti-racist, and so I think this is prescient. And I think with Jenny joining the DEI work of the town, I think would be highly appropriate and worth discussing.
I agree.
Okay, I agree also. So why don't we plan on putting that, put it on the next meeting agenda?
Or maybe the November meeting agenda, Mr. Chair, since we have the tobacco hearing next meeting.
Oh, that's true. That's true. That sounds like a reasonable thing to do. In regard to the next meeting, I missed an appointment that I have on October 16th. Is the 23rd okay for George and Jenny?
I'll just need 20 seconds to double check. And
Sure.
It works for me.
October 23rd works for me too. So October 23rd is fine.
Okay, thank you very much. I appreciate that. I had forgotten about an appointment that I had.
Not an issue.
Okay, so Kerry, let's go with October 23rd for the next meeting and public hearing.
Yeah, and just confirming, Mr. Chair, this is same time, 8 o'clock?
Yes, unless there's any problem with anybody else.
No, and presumably the agenda is still manageable that we would be able to wrap up, maybe close it at 9. I would just need to log off at 9.
I would think so. As DJ said, the tobacco regulation hearing shouldn't be controversial because they're just regulations that we need to include anyway. So, as he said, we may have no attendees anyway, so it may go just a few minutes, if that. So,
Sounds like a plan. So October 23rd at 8 o'clock. Sounds good.
yes.
And this is Carrie. I will work with Jennifer in regards to the verbiage that we'll send to the tobacco retailers with a copy of the proposed changes. We have to make those available to them. And then I have to post a legal notice 2 consecutive Fridays prior to the public hearing. I just have to figure out the details about, I don't know if we still have to do it remote participation or how all that works, but I'll flesh all that out.
Okay, great, Carrie. Really appreciate that. So I think we're done with the agenda. So unless anybody has anything else, do we have a motion to adjourn?
So moved.
I second.
Okay, all in favor signify by saying aye. George Abraham,
Aye.
Jenny Fishman,
Aye.
Steve Vigent, aye. So the meeting is now adjourned. And thank you, everyone, for joining in today.
Thank you. Have a good
Bye.
day. Bye-bye.
Thank you. Have a great weekend.
Thank you. You too.
Thank you all.